Welcome back to Joint Decisions. It's a web chat series to educate and empower people living with moderate to severe rheumatoid arthritis, sponsored by Janssen Biotech and Creaky Joints. The goal of our program is to provide people living with RA and their caregivers tools and resources that they need to have an active role in managing their RA. The educational content of a web chat is not intended to be taken as medical advice, and it shouldn't replace the recommendations and advice of your doctor. Any questions that are specific to your health or medication should be discussed with your healthcare provider. And participants in today's chat were compensated for the time they spent collaborating on the content for the Joint Decisions program. I'm Dr. Laurie Ferguson. I'm a health psychologist, and I work with creakyjoints.com. I would encourage you to go to our website, which is actually .org, creakyjoints.org. Please go and sign up if you're not yet a member. We're a large, vibrant online community that was created to support and empower and advocate for people living with RA and to empower them to advocate for themselves. So on our first web chat, we talked about how important it is to be treated by a rheumatologist for the management of RA, and on our second, we explored the topic of biologic medicines for moderate to severe RA and discussed that they can be administered in two ways: infusion by a healthcare professional at a doctor's office or infusion center, or by self-injection under the skin by you at home after training. And then in our third chat, we focused on providing patients with an understanding of the different forms of healthcare coverage in preparation for the open enrollment period. Throughout the chats, we have had several great guest speakers: a patient who's living with RA, Matt Eisman, Dr. Rebecca Callis, who's a board-certified and practicing rheumatologist, and Liz Schultz, who's a rheumatology practice manager. And for today's chat, I am excited to welcome back both Dr. Callis and Liz Schultz. Thanks so much for being here today.
Hi, Dr. Ferguson. This is Dr. Callis, once again, as you said, a rheumatologist, and I'm really happy to be back.
Great.
Thank you, Dr. Ferguson. This is Liz Schultz, and I'm very happy to be back for this last chat that we have in this series.
Great. Well, we're excited to have you both here for today's chat, which is titled Right Track RA, Helpful Tips for Continued Success in the New Year. And it looks like we have about 35 people participating with us live across the country today, which is fantastic, and we are so glad to have you. Now, you won't be able to see each other. You're just going to be able to see the panelists, but we know that we're all here together watching. And you're going to be able to send us your questions throughout the program using that function on the chat bar. We're just getting back into the swing after the holidays, and so we thought that it'd be appropriate to focus tonight for tips on keeping your RA goals or your resolutions on track through the new year. And my hope is that during this chat, you're going to be able to think more deeply about maintaining that two-way dialogue with your rheumatologist, working with your rheumatologist to set manageable goals for 2015, ways to find additional support when it's needed, whether it's educational, whether it's emotional, or whether it's financial, and ways for you to stay on the right track for managing your disease. Now, we're going to cover a lot of information, as you probably just heard, and you probably are going to want to take some notes, but also know there are going to be helpful resources for the information that are presented on creakyjoints.org/joint decisions, and that's the website that's on the bottom of the slides on your screen. We're also going to use the hashtag joint decision, so if you want to share your thoughts or any insights from the decision online, that's the hashtag to use. So I just mentioned you're going to find that option on your screen to submit questions for me, for Dr. Callis, or for Liz Schultz through the WebEx. And what we're going to do today is a little different than what we've done if you've participated in previous chats. Please go ahead and type in the questions that you have, and we're going to address them throughout the chat during the different discussion topics. Don't worry about if you don't hear yours, because we're also going to spend some time at the end that's going to have time for the chat. But we wanted to do this a little differently to keep the conversation engaging. As usual, please refrain from asking questions about specific brands of treatment, and we cannot answer specific personal medical questions about diagnosing or treating your RA. But before we even get started on the discussion topics, we want to hear from you. So we're going to start with a poll question, It's going to come up on your screen, and we want to know about your relationship with your rheumatologist. So here's a question. During an appointment with your rheumatologist, how open and honest are you about your RA symptoms? Number one, I come prepared with questions and information to share with my rheumatologist. Number two, I wait until my rheumatologist asks me questions before I tell him or her how I'm feeling. Or three, I find myself often holding back information from my rheumatologist during appointments for one reason or another. So please click on 1, 2, or 3, and then the submit button at the bottom of your screen. We'll find out how our participants are talking with their rheumatologist. We just have to wait a few moments for all the answers to come in, and then I'll tell you what our poll results are. Great, and here they are. So 69% of you come prepared with questions and information about what's going on. 13% of you wait until your rheumatologist asks, and 19% of you find yourselves holding back during appointments for one reason or another. So that really says something about why this chat is so important, because having an open and honest conversation with your rheumatologist is the first step towards effectively managing your RA. So now that we have a sense of the audience's relationship with rheumatologists, let's just take a minute to continue talking about how you might improve or deepen the dialogue that you have during appointments. First of all, how do you think about what your appointment is? It's really an opportunity for you to share how you're feeling and what's going on. We just heard in the poll, and we know in hearing from other people living RA, there's a tendency to hold back feelings. Maybe you don't want to be seen as a difficult patient. You're not sure if it's the right place to bring it up. Maybe you don't want to make too much of it. But in fact, anytime you soften or hold back, you're going to compromise your treatment. And so tonight, I just want to emphasize again, as I know Dr. Callis will, a candid conversation about your health is the most important thing you can bring to your appointment. Talking about what's actually happening with your condition and not suffering in silence or thinking this is as good as it's going to get. If your rheumatologist doesn't know what's going on, they're not going to be able to treat you as effectively. And sometimes when your symptoms aren't addressed, that's a time when depression and even deeper loneliness can set in. So the first thing is to bring that information in. Another piece of this conversation is don't withhold health or other personal information that you know is going on with your health. Your rheumatologist needs to know everything that's going on with you, even if it may not seem connected to your RA, in order to make informed decisions about the best medications, possible side effects, and what's going on for you. So whether you feel stressed, maybe you've been smoking, maybe you're concerned about your weight, sleep issues, all of that should come into the conversation. So deepening that dialogue really begins with you. But the second part of building your health care team has to do with how comfortable you are with the person who you're spending all the time with, your rheumatologist. You want to surround yourself with the best possible team you can, rheumatologists, nurses, and the office staff, to help you on your journey with RA. And if a member of the team isn't working for you, you have the right and the ability to make that change and find someone who is able to give you the support you need, because you need to feel comfortable with your rheumatologist. So in order to find the right fit, think about what's happening in your appointment. Now, sometimes you're going to begin with a new specialist, or you're going to find yourself with a different doctor, and it may not feel like you have that fit quite yet. And here I want to encourage you to take a moment, and sometimes what I encourage my patients to do is use the 3-date rule. So maybe the first time you see the person, you're not totally comfortable, you're not sure this is really going to work out. Take a moment and really review what went on in the appointment, and give yourself 2 more just to make sure of what's going on. Bring the concerns you have, interview that person and have a conversation with them. But by the 3rd time, if you're really convinced this is not the person for you, then it really is time to move on. This is really critical because your rheumatologist relationship is the central one to guide you through the ups and sometimes the downs of your condition. So we're going to change it here and do it a little differently. And before we move to the next portion, we're going to take a question from the audience. So here's the question that I have. Dr. Ferguson, sometimes during my appointments, I find myself forgetting to share important information with my rheumatologist. Any suggestions? So it's really easy to forget information. And even though I said bringing that in is one of the most important things, sometimes when you come in, there's a lot on your mind or things that have even happened on the way. So to help you remember, one of the things we encourage is to write your questions or your recent experiences down in a journal, both in the days and the weeks leading up to the appointment. Things that have been happening, things that have gone well, things not going so well. Make note of all those key points and then follow them up with discussion. Another way that I encourage people to keep track is to bring somebody with you, a friend or a family member, into the appointment, because that person may be able to articulate some of the challenges that you're going through, may be willing to help you be as candid as you need to be, and help you remember certain key points that you said you wanted to discuss. Sometimes others can paint a better picture of how you're feeling and how RA is impacting your life. Like when you tell the doctor that you're doing okay, but the person with you says, you know, remember you couldn't drive to work every day this month, or you missed a couple dinner dates. The third party also is going to help you process information and act as a sounding board afterwards when you're evaluating what happened, when you're trying to remember the advice you were given. So let's go to a poll question again and hear from you. We're going to turn now to talk about health goals for 2015. And so you're going to see popping up on your screen this question. So here are the options and what best represents your top health goal for this year. Finding an RA treatment that works for you, keeping a symptom and medication side effect journal so you can help make informed treatment decisions, becoming more physically active, building a network for emotional support, or all of the above. Which is your top health goal for 2015? Again, you click on it and then hit submit, and we'll wait a few moments to see how you all are evaluating your goals. We just have a minute here. Okay, you don't have to think too hard about it. Just go ahead and pick one and submit. One of the reasons we're doing this, of course, is that setting goals is one of the most important things we can do in terms of managing treatment. So 25% of you are going to work on finding an RA treatment that works best for you. 6% have a goal of keeping a symptom and medication journal. 31% are going to get more physically active. 6% are going to build that network for emotional support. And a third of you, 31%, see all of the above as great goals. So congratulations. Setting goals is a way to know where you're heading. And now I'm going to turn things over to Dr. Callis. She's going to talk about each of these different goals and give some tips for achieving them through the year.
Thanks for kicking it off, Dr. Ferguson. So first I want to talk about is finding the right treatment. As we all know, not the same treatments work for everybody. Not the same treatments even work for the same family members. So although you may be related to, your mother, sister, brother who also has rheumatoid arthritis, what works for them won't always work for you. So it's important to remember that you are unique, and the medicine combinations you take, whether that be pills plus the sub-Q medicines or the IVs or whatever, those combos are different for different people. The other thing I want to point out when it comes to, obviously we all have the goal of trying to control our rheumatoid, is nothing really works fast when it comes to medicines other than the anti-inflammatory medicines. So everything that we're trying to do as rheumatologists to help your rheumatoid arthritis is geared toward controlling the disease, and those medicines can take 3-6 months till maximum benefit at a stable dose. And so you need to work with your rheumatologist with treating the flares while waiting for those other medications to take effect. I'm really happy with the poll questions. Everybody was talking about a journal. I think journals are fantastic ways to record many different things. So when it comes to your emotional support and your psychological support with your rheumatoid and how it's affecting your daily activities, a journal is very important. I'm a true believer that writing things down or saying things helps you process what's going on, and a journal allows you to do that. Medically, and what can help your rheumatologist, a journal also lets you record the side effects that you're having from the medications or the side effects you may be having from rheumatoid flares. That is always very, very important for me to know what medications may be giving you side effects, or what medications, let's just put it this way, are giving you symptoms because you might not know those are side effects. So I'll kind of segue into a little caveat that's related to that, is your rheumatologist may ask you a lot of different questions of which you think are weird or unrelated, but it's because we're trolling or looking for side effects of the medication or of the disease, and sometimes those things can kind of flush themselves out in a journal, and I really do like that. The last part of the survey that we touched on is 33% of you, I think, were thinking about becoming physically active this year. That is fantastic, okay? Just because you have rheumatoid arthritis does not mean that you can't be physically active and that you can't try and participate in an exercise program. There are exercises, however, that are more safe for rheumatoid joints. So, for example, if your rheumatoid arthritis is active and you use that joint more, it's going to worsen the rheumatoid activity of that joint. Being consistent with your rheumatologist and telling them of your activity plans can help us try and modify the activities you want to do to make them more successful for you, or treat your disease flares through those activities so you can get back to what you want to do. There are many exercises that are approved by the Arthritis Association as safe arthritis exercises. And even in some towns, there's actually classes you can go to at gyms that are arthritis-approved exercise classes. So definitely look for those. They're out there quite a bit in most major cities. Some exercises are low-impact exercises. So that's anything that you can do in a pool, like pool therapy. It allows the joints to go through full range of motion without putting body stress and weight on them, so less likely to flare the rheumatoid. Walking is always very good, especially on cushioned surfaces. And then cycling, such as like the reclining bike, is very good. Obviously, no hardcore mountain biking or anything else like that. But those types of activities can definitely be beneficial because they keep the joint moving, they stop the joints from freezing up, and they also improve your cardiovascular health. So I'm really happy for the results that I saw in the survey and everything. And we're going to talk about some more of the exercise stuff a little bit later if we get any other chances. I'm going to turn it back to you, Dr. Ferguson.
Well, great. And we just received a question from one of our participants that's related to this and related to their health goal for 2015. And the question is, Dr. Callis, I'm thinking about running a half marathon at the end of 2015. Is that safe?
Oh, good question. I've not done a half marathon myself. I maybe thought about it. I think a 5K is as far as I've gotten. But so no, it's great to have goals. Just because you have rheumatoid arthritis doesn't mean that you can't have goals such as half marathons and marathons. It does mean that you need to have those goals maybe a little bit further out than a person who doesn't have rheumatoid arthritis. So the first thing when it comes to training for an intense physical activity, half marathon, triathlon, what have you, is slowly getting the rheumatoid joints to being used to handling that amount of impact or activity. So you need to talk to your rheumatologist, tell them that this is your plan, and we will help you try and wean on to an exercise regimen. It is also important that if while you're weaning onto that exercise regimen, you are having disease flares, that you let your rheumatologist know as soon as possible so we can, one, treat the disease flare so that it doesn't damage your joints, and two, talk about what other modifications we're going to do to your other treatments to better control the rheumatoid to make them be able to handle that impact on the joints. So as I said previously, all the medicines we use except for the anti-inflammatory medicines take 3, sometimes 6 months for maximum benefit. So we need to know that stuff really, really early to get you primed up for your race. Don't feel discouraged. I mean, when people try and train for something as intense as a half marathon or a marathon, normal people have setbacks. You know, rheumatoids, you'll have setbacks. It just might be more rheumatoid arthritis-related flares. It's okay. Just be honest and tell us what's going on. And maybe we have to modify things and maybe not. Like, you know, for example, say your joints can only handle you running 3 miles at a time. And every 3 miles, your rheumatologist might have you stop the run and walk a mile to compensate. And be open-minded that things like that is okay, because you want to do what's best for your health and best for your joints over the long term. That's a fantastic, ambitious goal. But like I said, just because you have rheumatoid arthritis doesn't mean you can't have goals like that. So that's fantastic.
Great. And Dr. Callis, we have another question for you that just came in from one of our participants. Dr. Callis, are there any suggestions for pre-screening a rheumatologist before you see them in order to see if they or their practice are a good fit?
Okay, really good question. So rheumatologists are trained medical professionals, obviously. So most rheumatologists do a residency in either internal medicine or family practice. And then after that, they do anywhere from 2 to 4 or 5 years of training after the internal medicine or family practice. When rheumatologists do not do research, they usually do 2 years, okay? So the first thing you want to make sure of is the physician that you're seeing, are they really a board-certified rheumatologist? You can call their office and ask, or you can actually look that up on the internet. Most rheumatologists will post that they are board-certified, and I do recommend that. There's really not a way to kind of interview the rheumatologist before you show up for the appointment, but you can ask around and ask other people if they've seen that rheumatologist and ask their opinions, especially if they're friends of yours or family members that might, kind of be the same personality as yourself. And I love Dr. Ferguson's 3-date rule. So the goal of the first visit is sometimes a little bit different from the doctor as it is compared to the patient. And I think that sometimes where things get off on a bad start. So the first goal of the patient, and definitely righteously so, is to make sure you fit, that you like the rheumatologist, that the personalities work together. Because I agree, it's a relationship. You need to go on dates and make sure you work so that you can communicate. And that's a good goal of the patient. The goal of the rheumatologist, thinking it from my standpoint, is going, okay, my responsibility is to take care of this patient, first do no harm, and make sure that they are doing well and that their disease is treated. So sometimes the rheumatologist, the physician, is more worried about the hardcore data of or what's going on, what medicines are you taking, when was your last labs, are you having side effects, have you had TB in the past, have you had hepatitis? Sometimes we come off a little bit too overly clinical and not maybe as warm and fuzzy the first appointment, but it's because, Hippocratic Oath and everything else, our primary responsibility is to make sure that your health is okay first. So don't ding us for that, okay, because we're trying to make sure everything's fine. And it does take a while to learn the diseases, So as I see a patient, everybody's rheumatoid has a different flavor. Some people flare all their joints. Some people flare some joints. Some people also get rheumatoid in their eye and all this other kind of weird stuff that happens. It kind of takes us a while to learn your disease and learn your flares and learn what works best for your flares when you first start seeing us. So kind of keep that thought in the back of the mind is yes, at least give the rheumatologist 3 dates or 3 visits before you really judge exactly how the whole conversation and the whole appointment's going to go. I think that's just a wonderful recommendation from you, Dr. Ferguson. I really do like that. I hope that answers your questions really well. The last thing I can think of off the top of my head is many rheumatologists, especially with all this internet-based stuff, do have their CVs or their resumes posted on their website. And even if they don't, you can usually call their offices and ask for a resume to see maybe where they were trained or if they have any awards or certificates or research that they are dedicated to doing extra care in. Yeah.
Thanks, Dr. Callis. That's great. And I know some people even use social media to find out about a practice. They use a Twitter network or their own RA friends and bloggers to check out. But I really just want to lift up again the difference that you state, particularly on the first appointment, of the patient's goals and what the doctor's goals are, and how do we begin to mesh those. And it does take a little time to get to know each other and to make sure that there is that fit. And part of the question that we're going to kind of switch gears and talk about now a little bit is emotional support. So we're going to ask the poll question of you are the participants. Where do you often go for your emotional support? Do you go to friends and family? Do you go to your rheumatologist or another healthcare provider? Do you use social media for emotional support? Are there advocacy groups? Are there groups that you join, or is there another place you go? And this kind of gets at the question, is the rheumatologist the only place or the best place to get your emotional support? So that is coming up on your screen now. Please click where you go, friends, family, rheumatologist, social media, advocacy group, or other. And particularly for those who might be clicking other, we hope that you will either through the question or through using the hashtag joint decisions, you might let us know some of the other places you go to get your emotional support so we can get a sense of what are the things that are best for nurturing and helping you take care of yourself. So again, we're waiting to hear. Just click on that and hit submit. And I hope that some of you are also on the question screen typing in your other, and we'll report that back in. So 38% of you go to friends and family. Sorry, Dr. Callis, nobody goes to their rheumatologist for emotional support.
It's going to hurt.
31% of you go to social media. 15% use advocacy groups for their support, and 15% of you use other. So again, we'll be looking for what some of that other is. And some people said for other, all of the above. So that actually, I think, is one of the best ways to build your network, is to find different places all around in your own community to do that. So because there's so many different kinds of support available, and you don't have to suffer from RA in silence. And in fact, it's better for the management of how you feel and the management of pain to go to different places for support. Your friends and your family are very important. Even though they may not directly understand, they can and often are your biggest supporters. So continue to share your triumphs and your frustrations with them. And again, as we said before, sometimes bringing them into the treatment so they really get a deeper understanding of what's going helps. Sometimes they can even join some of those forums like this one tonight or other online forums. They can understand not just you better, but how the disease works. Your rheumatologist understands the disease better than anyone. And again, I think sometimes if there is that fit, having those open and honest conversations can be a place to get some of that support. Social media is a great way to be in touch with others, to find out what's going on in terms of others' lives, in terms of other treatments, other ways people are finding just to live life as they want to. Blogs, discussion boards, to ask questions, particularly those who are newly diagnosed. This can be a great place to get not just information, but also warmth and support from others who have gone through it. And then advocacy groups like our own creakyjoints.org. We provide tremendous support for RA patients, and there are other places that we list if you go to our website, creakyjoints.org, and find places that might be near you. Now I'm going to take another one of your questions before we move on. So this one is for me. Dr. Ferguson, do you have any examples of how I can explain to my friends why I sometimes have to cancel plans because I don't have the energy? I mean, it's a great question, and, you know, sometimes people feel over and over there, I don't feel like going, I wish I could. How can I explain to you what it really feels like to have RA? For those of you who have been around with this disease for a long time, you know the spoon theory, and I find that very useful. If you're newer to this, I would suggest that you Google that. But the spoon theory is a way to kind of graphically illustrate what happens when you don't have the energy to follow through. And it began when someone who had RA was talking with a friend at a coffee shop and trying to explain where her energy went during the day. And she gathered up a bunch of coffee spoons, and she said, you know, for you, you get up, you take a shower, you have your breakfast, you check your email, you start thinking about what you're going to do. And then, you know, midway during the day, you may take a spoon out and say, I feel tired. She said, for me, getting out of bed takes a spoon. She put a spoon down. She said, and then I make it into the bathroom and I think about whether or not I have the energy to take a shower. That takes a spoon. If I'm going to wash my hair, that might take another one. And she went on through the day laying out how many spoons of energy daily activity took until they were all spread out on the table. And her friend could look at it and say, wow, I had no idea that it took that much energy for you to do each thing when she graphically saw this. So those of you who know this story, you know how to explain that to your friends. And those of you who may not be familiar with it, I suggest you look it up and read the story and think about a way you might also help your friends visualize what daily activities often take out of you, of course, depending on the day. So we're going to switch to yet another topic, and we're going to talk about benefits and insurance. But if not, Liz is going to give us a great overview of this.
Thank you, Dr. Ferguson. Yeah, I'll just go ahead and go kind of through everything. So there are many cost support programs available to patients to help with the cost of their medications, whether they be IV infusions done in your office or a take-home medication that the patient injects themselves. I would highly recommend that they check the website for the manufacturer of the particular medication, see what cost assistance programs they have available, and if they don't find what they're looking for, or they have additional questions, or just not sure if they qualify or not, then I would suggest they call their rheumatologist office. I spend a great deal of my time in the day talking to my patients about their benefits and what programs are available and actually how they work and how my office will assist the patient, and whether it's a copay card at the pharmacy or a rebate card in the office. I try to explain that to them so that they're fully aware when they start the medication to make sure that they can continue to afford it. Most of these companies offer a rebate card, so it doesn't matter really which medication you're on. There should be some type of assistance for them, particularly if you're a commercially or private insurance patient. They have better programs to help them with their co-pays, insurances, out-of-pocket maximums, and deductibles that are hitting at this time of the year since we're right at the new year. So those are things to look for. And again, really, if you don't find what you're looking for on the website, talk to your rheumatologist office, somebody in the billing department, or the practice manager. It just kind of depends on how their practice is set up. And then also, if you have no insurance, or if your medication is not covered under your plan, say it's a non-formulary or it's on a tier that's not covered well, you might be able to get some assistance from foundations to help you save on the cost of your drugs. I know that, for instance, Johnson & Johnson has a great patient assistance foundation, and that you can find on their website as well. There's really not a better time than right now. We're at the start of the new year. Check your plan. Deductibles and co-insurances and out-of-pocket maximums are hitting right now. So even if you have missed open enrollment and you are stuck with what you have, really reach out and see what cost programs are available to you at this point in time.
Great, Liz. Thank you. It's so helpful to, hear your practical information. So if some of our participants are interested in these cost support programs, where can they go for more information?
Definitely the manufacturer's website. So, if you're on a medication and you're not sure who manufactures it, ask your rheumatologist who's the maker of that drug. Or again, ask your rheumatologist's office. We have a lot of patient education materials from the companies to actually hand out or direct them directly to the website so that they can get that information that they need.
Great, thank you. Well, I certainly hope our participants are going to begin utilizing or continue utilizing the cost assurance programs that are available to them, and that they're going to start to see their own practice managers as resources who can help them navigate coverage and access. Until I met you, I didn't really understand how helpful the practice manager could be with all these insurance and coverage questions. So thank you.
Thank you, Dr. Ferguson.
So now that we've talked about our 2015 goals and people have them in place, I think the next question really is, how do we talk about staying on the right track throughout the year? So one way we do is we think about how realistic they are. As Dr. Callis has said a couple times in this chat, don't be overwhelmed or discouraged if things don't go as planned. You know, sometimes we have to plan for the unexpected. Start slow and don't overdo it. And be sure that in your mental attitude, your sense is that you're in charge of your health, and continue to build that team of people who are committed to helping you along the journey. So, Dr. Callis, we're going to turn it back to you and ask you to talk about staying on track with treatment, which was, of course, the #1 goal.
Mm-hmm. Thank you again, Dr. Ferguson. So the biggest thing I can tell you is compliance with your medication. So obviously nothing works if you don't take it. There's many studies out there that we as physicians, talk about when we go to conferences and stuff. Most studies show that patients are only compliant with their drugs about 33 to 35% of the time, and that's not very good. I like to think in rheumatology it's more than that, because our diseases, when they flare, result in pain, and I think that's probably true, but the biggest thing is compliance. We need to have you on medicines to make sure they're working, especially, like I said, these medicines don't work fast. So if you're taking these medicines and the medicine dips down in your system, and because you quit taking it for a couple weeks or a month, and then you hop back on, guess what? 3 to 6 months again until it kicks back in. So you kind of put yourself behind the 8 ball if you're not complying with the treatment. The other thing that's important is if you're not complying, let your rheumatologist know. We're all human. We fall asleep on the couch. We forget to take our pills. We get busy. The kid's crying. We gotta go get them or whatever. It's fine. Just be honest with us, because if we don't know you're not complying with your medications, we may increase the dose. Well, that is going to be a lot more toxic to you potentially, or toxic to your internal organs, because you went from nothing to super high dose as compared to nothing to going back on the drug. So it's always important to be honest with your rheumatologist. The other thing that we touched on so many other times is tell your rheumatologist everything that you can think of. I have patients that tell me a lot. They go, well, I don't know what I'm supposed to tell you. And I tell them, you don't worry about what you're supposed to tell me. You tell me what you want, and I will decipher whether or not that is related to your rheumatoid or what have you. Such as, my eyes are dry. Am I supposed to tell you that? Or, I have burning when I pee. Do I tell you that? Well, yes, some stuff is directly rheumatoid related, and some stuff is side effects of treatment. So tell your rheumatologist everything that's impacting your life or every health concern you're having, and it's our job to ask you secondary questions to determine if that's a side effect of the medications or the side effect of the treatment itself, okay? So give me the good, the bad, and the ugly is pretty much what it comes down to. Your rheumatologist is a rheumatologist. We're not dentists, and there's a reason for that, so don't make us pull teeth, okay? I do want to backpedal. Dr. Ferguson, you had a really good question about how can I explain to my family how I don't feel like doing stuff sometimes? And I think Dr. Ferguson had a great example with that spoon example of how to physically make it real for your family members and friends. And I'll tell you one that's more of like, I get this question all the time, but it's more medicine-based or science-based. So whenever your immune system gets active, it can make you feel icky. Okay, a good example of this is the flu. So most people of your family and friends have had the flu, and they can identify how absolutely awful they feel when they have the flu, okay? So for example, when your body gets the flu, it's mainly your immune system's response to that virus that makes you feel so icky or makes you have all those flu-like symptoms, such as the body achiness, the fatigue, and just feeling like somebody just sucked the energy out of you. That's more of the immune system doing it to you than it is the virus itself. That's your immune system getting active, trying to fight off the virus. So, for example, rheumatoid arthritis is a disease of the immune system being too active and being in the wrong place. So you can tell them, like, when your rheumatoid gets active, you kind of feel flu-like, achy, lethargic, no energy. You sleep, it helps a little bit, but it doesn't help a whole lot because of all the immune system activity. And my patients that use that analogy really seem to get a response from their family members because, like I said, most of us have had the flu and understand how awful it is. Okay. I'll turn it back to you, Dr. Ferguson.
Well, that's just such a great example, Dr. Callis, and to get clear that what's happening is the power of the immune system, that we want to, but when it's overactive, like when you have the flu, you feel sick. That's a great example. Thank you. Also, I think one of the things that you really have helped us understand is being honest about our symptoms, being honest about what's going on is not about, we're not going to disappoint the physician. When we say a treatment's not working or we're not feeling well, and our job actually isn't to take care of the doctor. But sometimes we go in and we start, backpedaling or soft pedaling because we want you to feel good about your treatments for us. So thanks for reminding us. It's really important to bring it all in and you can take it. So I found some questions that are being asked. Liz, I'm going to toss you this ball. Liz, I found cost support program information on the website of my medication manufacturer, but I'm unsure if I qualify based on my current insurance plan. Where can I go for help?
Okay, so very good question. Most of us, we get our insurance through our work and we just get the plan that our employers have purchased. So we have absolutely no say in that. I highly suggest that they go to their HR person and get like a summary sheet of their benefits. Start with that. It actually will spell out what their co-pays are, their co-insurance amount. That's that split where the insurance will pay like 80% of the allowed charges and the patient's responsible for the other 20, up to some out-of-pocket maximum, at which that point in time, then the insurance might pay in full. You can get a summary of benefits for them. If you don't find all your answers there, you can call the customer service number on the back of your card, and they're usually really helpful. You give them your ID number and your group number, and you say, hey, I have rheumatoid arthritis. My doctor is wanting to put me on product X. How is that covered? And you can tell, and then you can call back the pharmaceutical company assistance program and say, these are my benefits. How will you be able to fill in the gaps here? And again, even if you don't call them and don't get all the answers, again, talk to somebody in your rheumatologist's office. I actually explain benefits to patients on a daily basis. Managers generally can live, eat, and breathe this kind of stuff. It's what we do and how we manage our practices for our infusion patients or our sub-Q patients. So we're fairly well versed on what these terms mean and can help navigate it for the patient. I hope that answers their question.
Great. So the first line of defense is we make a lot of phone calls, but I think that's how you get information. We go to the website and we ask and keep asking, and then again come to the practice manager at the rheumatologist's office. So
yeah, exactly.
Right.
Unfortunately, you get this plan and you don't have any choices. So your HR department, as the employer, is generally a very good place to start.
Right, a great place to start, to just start with your own HR department. So there was a question for me. I've just started journaling, but I'm having trouble keeping up to date with it. I find myself having to go back to make entries. Any suggestions on how to keep more current with journaling? Well, the first thing I want to say is good for you for starting. And second of all, keep it as simple as possible. So I think the easiest thing is don't feel like you have to have full sentences. And keep it someplace where you have ready access in either probably the end of the day is best, if it's in the bathroom or by the bed, and you just jot down a few things that happened. Just kind of think back over the day. What were some symptoms? Were there any, what's your pain level? Have there been any flares? What was your sleep like? As Dr. Callis said, are you having any trouble eating or any other thing that might be unusual for you? But just to jot a few things down, it doesn't have to be, you're not writing your memoirs. So if you can keep it as simple as possible, it's easy to stay current. And again, to have it accessible and easy. You get a little notebook that you keep someplace where you have it. So Dr. Callis, the next question is for you, and that is, how can I tell if my treatment is working?
Really good question. That's a really good question. I want to say one thing about what Liz said on cost support, just to make sure patients understand a couple things, is don't worry. Most of our medicines are expensive. Everybody calls us, and don't worry about asking your rheumatology office. You're not the problem child or the problem patient if you have to call because you're having problems with cost support. Unfortunately, our medicines more than not can be expensive. So all rheumatology offices are really experienced with this. So definitely just call them if you can't figure it out. My motto is with my patients, no drug is good if you can't afford it and can't get it, okay? So we need to get it in you so we can increase compliance and maintain and gain disease control. So like you asked, Dr. Ferguson, how can you know if your rheumatoid arthritis treatment is working? That's a really good question, okay? So when you think about rheumatoid arthritis treatment, rheumatoid arthritis, as we said, is the immune system inside of the joint, and it's the immune system that gets inside of the joint and eats away at the joint and causes inflammation and damage to the padding and maybe even damage to the bone sooner or later. So what we need to do is bring down the immune system to get the ooey gooey immune system out of there to stop causing damage. That's what our drugs do. That's what the IVs and the pills and the sub-Q medications do, is trying to get the goo out of the joint. So what you're looking for, if the medicine is working, is the swelling of your joints is getting better, and you can sometimes physically see that, or if you're not good at seeing that, you can kind of infer, like, my rings are fitting better, my watch goes on better, stuff like that. The heat of the joints may go down as you get the gooey rheumatoid out of the joints, and also the stiffness, especially the morning stiffness, may get better as you get the gooey stuff out of the joints or the active rheumatoid out of the joints. What might not always get better is the pain, unfortunately. So pain, when my patients talk to me about pain could be from the active ooey gooey rheumatoid causing inflammation and swelling in the joints, or it could be from the damage that the rheumatoid did. So when patients say joints hurt, you kind of have to do a little bit more investigation with questions and definitely a physical exam to see, is it hurt from the swelling in the active disease, or is it hurt from the damage done that is left over and all the active disease is gone? So it's really important, especially in your journals, to record when the pain happens and how long the pain is there for. For example, if you have active rheumatoid arthritis and you're stiff and painful in the morning for an hour or two, that's different than, and I think of that as active rheumatoid, as compared to you say, my wrist hurts, but it only hurts for 1 second when I pick up the grocery bag. You know, that is more stuff that you see from damage pain, because the padding is physically gone from the joint because the rheumatoid ate away at that padding, okay? All of the medicines that we look at and we have in rheumatology, unfortunately, at this day and age, nothing has been proven to 100% halt or stop the rheumatoid arthritis from progressing. So the way to think about that when it comes to your symptoms and stuff is lots of patients say the medicines that they first took for the rheumatoid arthritis when they first got diagnosed worked the best. Well, that may be true, because although we can greatly slow down the disease, we can't completely stop damage from happening. So the longer that you have rheumatoid arthritis, the more damage you're going to have to the joints inherently, the more chronic pain issues you might have with the joints, even if the medicines are working well. So many patients, you know, I get into conversations with them that I look at their joints and I say, this is fantastic, your medicines are working, this is great, there's no swelling, there's no stiffness, there's no heat, there's nothing, the rheumatoid's under control. And they look at me and go, oh, well then why do I hurt so much? And then that's when I have the conversation about the damage that's there. And that conversation is different of what you do for damaged pain and fixing joints, such as replacements or other injections or something else, or braces or something like that. That's totally different on how we handle that as compared to the active rheumatoid arthritis. So be giving with your information of the quality, the timing, the aggravating and the alleviating factors for your pain, because that will definitely help your rheumatologist be able to tell, is it the treatment working and you're having damage, or is it not the treatment working at all? I hope that makes sense.
Thank you, Dr. Callis. It's so helpful. And of course, it really, again, underscores why the need for emotional support and creating goals and a plan, because on the one hand, you're working to control the disease, but you're also going to live with a lot of after effects for a long time. And so that, you know, we need all the help and support we can get in a lot of ways. So here's our last question for tonight. It's for you again, Dr. Callis. On the topic of exercise, should we describe it the same way we describe the fact that medicine doesn't work the same for everyone? Everyone's different and will respond differently to treatments just the same as exercising. For example, I'm a triathlete. What do you think, Dr. Callis?
No, I definitely agree. So for one, everybody's rheumatoid is different. I have some patients who have had rheumatoid for 20 or 30 years, and they have significant destruction of their wrists, but their fingers aren't that bad. You know, so everybody's rheumatoid sometimes can try to to attack certain joints a lot more than others. And so, yes, some people, because of that, can sustain different physical activities than other ones can. So it's more of a manifestation of how your disease is. And then also, people's diseases like to respond differently to exercises. I have some patients who can actually run, but by golly gee, when they hop on a bike and pedal, their arthritis just can't handle it. It likes to flare up in their knees. And so you like to try different exercises, usually joint protective exercises. And if you do try them, you like to try them at small times and small frequencies, and like I said, wean on. And when I have patients wean on to an exercise, I usually tell them something like this. Say you want to start walking because it's great for your heart health. You walk a quarter mile a day until it doesn't flare your rheumatoid. When that doesn't flare your rheumatoid, you walk a half a mile a day. When that doesn't flare your rheumatoid, you walk a full mile a day, and you keep on doubling your times. If you're not able to keep on going up in your physical activity, that's like when we talked about before, you call your rheumatologist and you let them know, hey, my rheumatoid treatment is not keeping up with my activity. What can we do? How can we adjust? Okay. In general, we tend to try and say avoid high impact exercises, and those are things like running and heavy weightlifting and things like that. And if you're dedicated and by golly gee, you want to become a bodybuilder, you know, more power to you and kudos, but you might have to modify it a little bit. Weightlifting and things like that needs to be low weight in joint neutral positions with higher repetitions. So for example, instead of lifting 50 pounds and bench pressing 50 pounds, you may lift 25 pounds, but bench press it 20 times instead of 10 times. In joint neutral positions, most gyms do have physical therapists or whatever those people are called that coordinate your exercises and stuff like that. You can actually go to them and ask them what is joint neutral. You know, joint neutral of the wrist, let's see if I can get it on here, you know, it's not this. Most people like to lift like this. That, this, good. That's less pressure on the joints. Also, things too that result in joint locking is bad. You do not want to lock your joints. When you lift, let's say for your arms, for example, if you lift all the way up and lock your elbows, that is bad. You don't want to lock any joints when lifting anything. Same with leg presses. All that does is take all that weight you're lifting and pound it right back on the joints and make it more likely to make the rheumatoid arthritis to flare. So I know that's kind of a tangential, long answer to your question, but yes, everybody's different. Learn how to modify, tell your rheumatologist, make sure that you're doing things ergonomically correct so that you're less likely to aggravate the arthritis.
So for all of you who have that top goal of becoming more physically active, there's been a wealth of some great information tonight, and of course, going to a trainer and getting some other information is helpful too. Dr. Callis, you're just amazing. So thanks everybody for joining us in today's chat. Thank you to Liz Schultz and to Dr. Rebecca Callis for all your expertise and helpful advice. And to all of you participants, we hope you found the past 4 chats to be educational and informative and supportive in helping you, because we know that living with RA is a journey, managing the symptoms, figuring out how to take care of yourself. Please do visit www.creakyjoints.org/joint decisions. There's more information, there are more resources, there's more possibility for your own advocacy for yourself and for the disease. You'll have information from today's discussion along with the videos of the first 3 chats in the series. We also encourage you to keep that conversation going online by using our hashtag #JointDecisions. In a few minutes, there's going to be a survey that will come up on your screen. Please take a few moments and complete it so we can better serve you in future chats. Simply close out of the chat window, and then the survey will appear on your screen. You have to close out first, and then it shows up. Thank you again for being with us. We look forward to talking again.